having adequate trained midwives helps reduce infant mortality and women dying in childbirth. Laos is making efforts to resolve acute shortage of midwives through a new midwifery training program.
Samapet is one of the first graduates of a new midwifery training program in the Lao People's Democratic Republic. From her base in a rural health center, she serves a dozen surrounding villages. Nanglao's village is one of them. During her last delivery, Nanglao almost bled to death. She had her baby at home without medical support. This time, Samapet examines her and advises Nanglao to go to a health center when she's ready to give birth.
The midwife told me I should take care of myself and eat well, so I will have enough blood when my baby comes. If I feel the baby is coming and I can't get to the health center, she said I should contact her.
Before Samapet was trained, women here were on their own. Experts say that some 350,000 mothers and millions of infants die worldwide each year from complications related to pregnancy and childbirth. Most of these deaths could be prevented with more skilled birth attendants and better access to emergency care. Laos, a poor, mountainous Southeast Asian country with a severe shortage of skilled medical staff, has pledged to improve maternal and infant care as a commitment to the UN Secretary General's global strategy on women's and children's health. Closing the personnel gap is the first priority. With support from the UN Population Fund and donors, 140 students, mostly auxiliary nurses, enrolled in a midwifery course. Trainees honed their skills by delivering babies at a nearby hospital under their teacher's guidance. Potentially life-threatening complications occur in about 1 in 7 deliveries. Women giving birth need a skilled attendant who knows how to respond to obstructed labor, hemorrhage, shock, and infection, and there needs to be an accessible referral facility. Before her training, Samapet lacked these skills.
I knew some things before I took the course, but my knowledge wasn't very clear. For example, I didn't know the danger signs. Now I can recognize a dangerous situation, and I can tell whether I'll be able to cope with it or not.
Now she's confident, and there has been a steady increase in clients coming to her health center. Samapet also provides family planning advice and child immunizations. Reaching women in distant villages remains a challenge, but local health volunteers assist health centers in keeping track of pregnancies throughout their areas, and the midwives make house calls when they can. Laos has a long way to go to ensure that all women can give birth in safe surroundings, but the country's new midwives are an important start.